You may be wondering, how can I make the most out of my surgical consultation so I can be sure that I'm going to make the best decision about whether or not to have cosmetic surgery? One of the first things you can do is get as much information as you need to determine the concerns that you have and whether or not you might be a candidate. Now, some people don't need very much information. They just know what they would like to have done and they're ready to proceed. But there are other people who like to get as much information they can, whether it's on the web, talking to friends, talking to their doctor, whatever. So you do what you need to do to have all the information that you think you have. The next thing you want to do is really be very specific with yourself in what it is you don't like about your nose, if it's your nasal shape, or what it is you don't like about your signs of aging, so that you can tell me exactly what you'd like corrected. This really helps me advise you the best non-surgical and surgical treatments that might help you. It's also important to express any concerns or worries you have about the procedure, or about the recovery, or about the results. So if you can remember these, fine. But if you can't, then write them down so that when you come to the consultation, you can ask me all the very specific questions you'd like to have answered. Also, you will want to have asked yourself, well, if I do have the surgery or do have the treatment and I'm happy with it, how will this change my life? How will it make it better for me? And in doing so, you will be helping to determine yourself whether you're a good candidate for the treatments or procedures that you're contemplating. And finally, ask yourself, why is this a good time to be doing this? Maybe it is, or maybe it isn't. If it is a good time, you should be able to be determining for yourself how you're going to take the bit of time, if it's non-surgical, just a day or two, but if it's a surgical procedure, up to 2 weeks out of social and professional activities that you can have this work done. So once you come armed with all of this information and with these questions, then you should be able to leave our consultation with an excellent idea and the ability to make the decision as to whether to proceed with cosmetic surgery or not.